Welcome to the Mastering Therapy podcast. This is a show for psychologists, psychotherapists, and counsellors who are looking to build on their therapy skills, increase confidence in working with clients, and be inspired by alternative models, tools, and ways of working.
I'm your host, Dr. Natalie Stott. I'm a clinical psychologist and founder of Supervisor Platform, a directory that supports clinicians to showcase their supervision and training to other therapists.
Join my guests and me as we learn from one another and aim to take insights and put them into action.
Welcome everybody to this week's episode. I'm really delighted because it feels quite different to what I normally do. This week we are thinking all things energy psychology, and I have got the energy psychologist with me as my guest. She's a clinical psychologist and also trained in energy psychotherapy. So welcome to the podcast, Coral.
Thank you, Natalie.
I wonder if you could just give our listeners a brief overview of who you are and a little bit of background about just specifically about your training.
Absolutely. Yeah, I'm a clinical psychologist. I've got my doctorate in clinical psychology, but then I trained in a modality called energy psychotherapy, which combines energy psychology techniques with talking therapy techniques. Energy psychology is an umbrella term for different techniques that work with energy. So it recognizes that as well as a physical body, an emotional body, a mental or cognitive body, we're also an energetic body. And energy psychology draws on techniques that work with parts of our energy system, such as chakras or meridians, that have been worked with in different cultures for thousands of years.
Great. I feel perfectly positioned to be asking you these questions, Coral, because I would consider myself an absolute newbie, rookie, very low level knowledge on some of this stuff. I think if you'd have said the concept to me, energy psychology, maybe 5 years ago, I might have been very skeptical and maybe even turned my nose up because I didn't understand it. And I don't know if it's think about entering my 30s, but I feel so much more open, and I have seen the huge impact on my own life on engaging in practices like breathwork, in polyvagal theory, and really understanding the role of the body in our stress and in our mental health. So what you do, I think, is going to be so helpful to, one, learn about, but two, maybe learn a couple of things that we can integrate into our practice. Energy psychology, I think you explained it really well. In practical terms, when you talk about an energetic body, what are we talking about?
I think it's important early on to say you don't have to have spiritual or religious beliefs to practice energy psychology. But I do have particular spiritual beliefs that I feel for me enhance and contextualize this practice. It depends how deep you want to go. But fundamentally, we are more than our physical body. So for me, it is positioning myself beyond this physical body and the emotions and the thoughts that I have and connecting into something bigger. So me as part of something bigger. But an energetic body means that we have different parts of our system that work together and drive it. So the meridian system is a part of our energy body. And the meridian system is energy channels throughout the body that connect the organs. The chakra system is a part of our energy body, and that is core centers in our system that relate to different positions in our body, but also different aspects of ourselves, or connecting, for example, throat chakra to voice and communication. So there are a number of different aspects and parts of the energy system that work together, that run our energetic body and meet the energy outside of us or in the world.
Okay, so just if you were to say to somebody, oh, you've got your brain, the brain is made up of your prefrontal cortex, your amygdala, you've got all the various different parts of the brain. So the energetic body is, am I right in thinking, more of an umbrella term? And then you've got these heart centers in various different parts of the body, and then the meridian systems like channels throughout the body.
Yeah. So there's a number of different aspects of the energetic body.
So obviously these are things that wouldn't be able to be scanned or measured. So I'm interested how you tap into or get people to tap into these systems. Are you using these almost like metaphors, or does it have to be practical? So I'm thinking, if I'm trying to describe what stress is to somebody, you might get someone to tune into what they notice their heart doing, what they notice their muscles doing, what they notice is happening to their breath. So when you're going through explaining the energetic body to a client, how do you make that practical, or do you not?
Yeah, that's a lovely question. So I think I want to say that our energetic body encompasses our physical, our emotional, our cognitive. When we're working at the energetic body, it's deeper and all-encompassing. And at a more practical sense, as you were describing, I will invite people to tune into their body, because where we most often notice things is within our body or within our thoughts. But when we work at the energetic level, we're capturing more. So we're working deeper, and we're clearing out more themes or issues that might have a physical component, an emotional component, a mental component, but we're capturing all that in one go.
Okay. And how does somebody get into something like this? In training, we don't do anything on really the somatic practice or polyvagal theory. Maybe I'm doing my training a disservice. Really like thoughts, feelings, behaviors, the fight or flight response in the body, but it doesn't really go beyond that. So I'm wondering, with a clinical psychology background, what your route into energy psychology has been.
Yeah, thank you. I think it's important to say that there are types of therapy that incorporate more of this type of work. But I grew up with an ill father who was bedridden from ME, chronic fatigue, for many years, and he did not get very far with Western medicine. So actually we had a wonderful GP who was very supportive in the days where chronic fatigue was called yuppie flu and was not really very supported or believed. But when they reached the edges of what Western medicine could do, my parents turned to all different types of alternative approaches to healing, health, well-being. And so I grew up, it was early days of internet, so it was much more people visiting the house or corresponding through letters. And I grew up exposed to all weird and wonderful people and belief systems and attempts for my dad to get well. I think probably growing up with an ill parent, I was very interested in caring and finding ways of supporting people.
Yeah.
But that went beyond the psychological or the mental health aspect to the full person, to the physical health, the mental health, the embodied health, and incorporated spiritual or alternative aspects of and approaches to well-being.
Okay. And I'm wondering whether you saw a positive impact on your father as a result of exploring these alternative approaches. I'm guessing so, because otherwise I'm imagining it wouldn't have led you into today.
Yeah, and I can't say there was an instant transformation in his health, but he did eventually stop being bedridden and get up, and he was expanded in lots of senses, as well as physical health, his fullness and richness of spiritual beliefs, coming from a kind of very conservative, dogmatic Christian upbringing. Yeah, he found a lot of value in the new approaches and ideas that he grew through, really.
Yeah. And when you're seeing clients, Coral, are they people that have sought you out because you are the energy psychologist, as you have branded yourself? Do you still find that you need to do a fair bit of psychoeducation, just like how you've been explaining to me as to what chakras are and what an energetic body is and why it's important? Is that important before you begin this type of work with somebody?
I think, like you said, maybe 5 years ago, there would have been a lot more background needed. But more and more people are becoming familiar with concepts of energy and using them in day-to-day language through the context of yoga, Reiki, different energetic practices in all different areas. And so more and more people are coming to me because this aspect of their life is not so often available in a therapy context. And it's something that they're really interested in. And where more traditional talking therapy has not proved useful, and they found value in other energetic practices, people more and more are coming to me with an interest of what this can add to the work.
And do you use other models alongside your energy work, EMDR or IFS or CBT, or do you solely use, is energy psychology the sole model, if you like, that you're working with?
Yeah, I'm trained in EMDR and I still use it a bit, but I find that the energy work is both deeper and more gentle. I have some training in IFS and I integrate that into my practice, and I feel that works really well with the energy work, with parts and preparing the system for change and getting all parts on board with change can work really beautifully with the energy work.
Say somebody comes to you and you're seeing them for the first few sessions. Most of us I would say when we're doing an assessment, you're maybe gathering somebody's history, they're presenting issues, what their goals might be. What do you do differently in terms of incorporating energy work? I'm trying to imagine how it might look. How do you introduce this idea of energy flow or energy being blocked? Or is it that when you're talking to somebody, you might be picking up on that? How does it differ from maybe what you might have been trained in or what you might expect?
I think a general explanation that I will give to people is that when we go through life, particularly our early life, and we encounter experiences where it's not been fully safe or possible to feel, to express, to be met in those experiences, then they can't always move through us fully. And so they often get stuck in our system, in our bodies, and in our energy systems. And so this practice is about identifying what is stuck and how that blockage continues to play out in our relationships now and in the way we live our life now. So often I will invite someone to tell me about a recent challenge, whether that's an argument or something that's been particularly difficult in the present, and then take that and trace that back to earlier life. So I use float back or bridge back techniques from EMDR to really locate that in early life. But I'll be drawing out a lot of core themes. I really put a lot of value on our early life, our kind of attachment experiences, and use that to inform the energy work. But practically differently in the session, once we've between us identified some of those core issues or themes, then I will be inviting to bring in energy psychology techniques. So using either tapping on the meridians or holding the chakras and naming the core theme and helping that move through in that process.
Okay. Forgive me, I really am a complete rookie in this. Are you getting them to touch parts of their body? Are you drawing things out?
Yeah. So the most common and the most well-known energy psychology technique is EFT, emotional freedom technique, or tapping, which is becoming much more well-known and has more research behind it these days. We might use EFT or a kind of variation of EFT. There's a setup phrase in EFT where they name the problem and then say something like, I love and accept myself, or whatever is possible. That's a bit strong for some people to actually believe, or I'm working towards loving and accepting myself, something like that. So I might draw out their words. And many years ago, I was very interested in narrative therapy and the power of language. So I'll be really trying to stick closely to their words and the words that feel most charged, and be inviting, naming the problem and offering this love and acceptance to themselves and tapping that through, or holding the chakras in turn and naming the problem and breathing that through with the breath and out into the earth.
Okay. And does it matter where you tap or the speed at which you tap? So I know many people are EMDR trained and will be familiar with bilateral stimulation being a really vital part of processing, and also the speed at which you're processing, depending on whether you're processing or installing a positive cognition or affect. Is that the case with energy psychology? Do you vary the speed of tapping or the location depending on what the problem is or what the blockage is?
EFT is tapping on meridian points. It's a standardised technique that taps on the same points in each sequence, that takes key points on the meridians that are linked to particular emotions. So the position of that, if you do standardized EFT, doesn't change. You work through particular points of the body that are linked on the meridian channel. But in an energy psychology, there are other variations of EFT, or you might move away from the standard protocol and in particular places. So, for example, chin is linked to shame. So you might come there if you're talking about shame, for example.
Okay. So do we all have the same meridians and the same chakras?
Yeah.
Okay.
Slightly different positions on our body, but roughly the same, yeah.
I wonder whether it might be helpful to do a bit of an example, just to give people an idea of how that might look. I realise we haven't planned this. What do you think?
Yeah, absolutely.
Like an exercise or something that we can do together?
Yeah, totally. And then people could tap along at home or try it themselves. Yeah. Like I say, if I was doing this in a therapy session, we would be talking a bit more generally and distilling down to the most charged elements or the themes. But like I say, EFT is a technique that is becoming more well-known, standardized, and can be used by everyone. So there's lots of YouTube videos. So it's a useful thing to know and to try. And it can be used for any aspect of our experience. So a physical discomfort or an emotional challenge or a thought, any variation. So we could do a really standard EFT on something.
I'm traveling tomorrow. The whole family, we have been traveling for 2025, and we're starting our travels again for the second time this year tomorrow. And I feel incredibly stressed today. I just can notice it in my body. I feel really stressed because after this podcast recording, there's so much to do. So this is really nice because I can I'm protected from it in this call, but the minute my mind goes to how much there is to do and pack, and I feel anxious even just talking to you about it. Is that something we could roll with?
That would be lovely, Natalie.
Okay.
To bring in that. If I invite you to tune into that and the anxiety and how much there is to do,
Do I close my eyes?
It's up to you. You're very
Okay.
welcome to whatever's.
Okay.
Where do you notice that in your body?
Probably in my chest, really.
Mhm.
Like the chest and almost the back of my throat.
Okay. And can you bring a few words to describe how that feels in the chest and the back of your throat?
It feels like buzzing is the feeling. Like it feels like it's moving. And it does feel heavy.
Yeah. Thank you. So, can I check with you, Natalie? How do you feel about saying, I completely love and accept myself?
Yeah, I can do that.
You can do that. Lovely, thank
Yeah.
you. And I'll just put in for the video that if I was doing this work with somebody, then of course we could work on the present. But if I'm doing deep work with people, I might take it a bit further and see what else is going on. But we will absolutely stick to tomorrow.
Great.
and the challenge around that. Okay, so what I'm going to invite you to do is to tap along with me. We do the setup phrase by tapping on the karate chop, it's called. The meridian channels run down both sides of our body, so we can tap either side and we can move between, just honouring your body's comfort.
Okay.
So I'm going to say some words and invite you to repeat after me. But if anything I says isn't quite right, then you change the words to best fit for you.
Okay. And I'm just copying you?
Yeah, just tapping along. So,
even though
I'm stressed about all that I've got to do.
I'm stressed about all that I've got to do.
And all that the travel will involve.
And all that the travel will involve.
And I'm feeling heavy and this buzzing in my chest and throat.
And I'm feeling heavy and this buzzing in my chest and throat.
I deeply and totally love and accept myself.
Love and accept myself.
And take a deep breath there. And allow your breath to move it through.
Even though
I'm holding this stress in my body.
I'm holding this stress in my body.
And there's so much to do.
And there's so much to do.
I deeply and totally love and accept myself.
Love and accept myself.
Take a deep breath. And breathe it through.
Even though
I'm feeling heavy in my chest and throat.
I'm feeling heavy in my chest and throat.
And I'm anxious about all there is to do.
And I'm anxious about all there is to do.
I deeply and totally love and accept myself.
Love and accept myself.
Take a breath there. And I'm going to invite you to tune in to that, your chest and throat, and just notice, is it the same? Is there any different sensations? What are you aware of there?
I feel like I don't actually feel it in my chest, but I don't know if it's moved to my stomach. I can feel something in my stomach that I didn't feel before.
Okay, yeah. And do those words, heavy buzzing, do they still fit, or is there any different way of this?
Yeah, no, I don't. I actually don't feel the buzzing. Before it was like that urge to do something, almost like the restlessness, but I don't feel that. But I feel Yes, I don't have it in my chest, but I just do feel still in my stomach. It's not buzzing, it's like a weight.
Oh, well. Just tap on that. So I'm going to show you the points to tap and invite you to tap.
Okay.
So the top of the head.
Yep.
This weight in my stomach.
This weight in my stomach.
The next point is the inside corner of the eyebrow. This weight in my stomach.
This weight in my stomach.
And keep your breath moving through. And outside corner of the eye, this weight in my stomach.
This weight in my stomach.
Under the eye, this weight in my stomach.
This weight in my stomach.
Under the nose, this weight in my stomach.
This weight in my stomach.
On the chin, this weight in my stomach.
This weight in my stomach.
And the collarbones, this weight in my stomach.
This weight in my stomach.
I'm just going to invite you to tune in. How does that feel? The same? Is it any different? What are you aware of now?
I have to say, if people are listening to this and they're not watching it, I'm conscious of how it might look. It does feel less. I don't know if I meant to say that, but it does feel less. I'm also that thing of me like, how's this feeling less just from touching different parts of my body? But it does feel less. There is a lightness there. I don't feel that same heaviness. And this is, I think, maybe what clients experience in EMDR when they go, am I doing it right? Am I saying the right thing? Is this how the direction it's meant to go? Yeah, I do feel different. Yeah.
Would you like to leave it there? Or would you like to...
Yeah, I think that was really helpful. And this is why I think training is so great, when you can be on the other side of it and you experience things for yourself. So without going into lots of details, obviously you've got expert training in this, all these different points that you're getting people to tap. So this is what you would learn when you're doing EFT, which parts of the body relate to different parts. Like, I'm assuming if I'd have said, oh, there's this feeling in my shoulder, maybe you would have tapped different parts of the body. Is that right?
Not totally.
No. Okay.
So EFT is a standardised protocol, the same places to tap. And actually, there are other places you can carry on tapping if things are a bit more sticky. But I agree. But so the great thing about EFT is you don't need training to use it on your
Oh, really?
Actually. So there's loads of YouTube videos about how to use it. If it's okay, Natalie, I just want to come back and speak to some of the things you said.
Yes, please.
Because firstly, I believe that our challenges, our difficulties are so multi-layered, and that there are core threads that go back to our very early life, our ancestry, things that have been carried in the family, and the challenges that we have in the present can help us identify the core threads. I love the float back technique because it so quickly can drop us into the roots and origins of our current challenges. And that when we follow these threads back and we use the energy work, it's like it's clearing a layer out, a layer of the old challenges, of the old dross. So when we are using the energy work, we're clearing out layers of the accumulated old stuff that we haven't been able to process or fully express or move through. And what we did in the EFT was chase the symptoms. So the challenge might move to somewhere else in our body, as you noticed, or we might have a thought or a memory or an emotion, and we would chase that. A bit in EMDR, it's all connected. But I loved what you said about, I feel a bit lighter. And it's my belief, and the belief in energy psychology, I'm pretty sure, that actually our natural state of being is flow and lightness and ease and joy, but that it's the unprocessed, blocked experiences that stop that flow and bring challenges. And that by following these threads back, rather than addressing these thoughts I'm having or these emotions that are coming up in the present, when we can trace them back to the roots and origins, the energy work is very powerful to move these big old blockages from our system and help return us to that state of flow, ease and lightness.
So would somebody be able to know if their energy is blocked? So for example, that feeling that I said that I was having, is that an example of blocked energy?
Yeah. So I would say any aspect of our life that is not easeful and flowing would suggest to me blocked energy.
Okay. Great. And how you go about, I guess I'm wondering, when you decide to use EFT or whether you use a different aspect of energy psychology, will that just be dependent on the client that you're working with and the presenting issue they have? Or is EFT the core training that you use?
No, EFT is one of a number of different techniques. There's more chakra-based techniques. There are techniques there's a lovely one called Ask and Receive that in IFS there's the self-leadership kind of aspect of self. There's a lovely energy technique called Ask and Receive that connects us into our wise high part, which I think of similar to the IFS self-leadership. And the language in that says, there's a part of my being that already knows how to, and then names what you're struggling with or want more of. And so there are practices that use language or intention more. Different people prefer or find more quick results from different techniques. So some people, I will use one technique much more in our work, and some people we jump around and we kind of tune into which feels best for this issue or which. So it's a co-collaboration of where do we go next.
Okay. And on the tapping, what is the tapping actually doing? And maybe that's a complicated question, but in its simplest form, what's its function as you're saying those words about loving and accepting yourself? What's the function of the tapping?
The tapping is connecting to points on the meridian.
Okay.
The setup phrase, the karate chop, is on I think it's on the small intestine meridian channel. And so it's around clearing waste. So tap in here and name in the problem, then connects us to the processes of clearing waste. And all of the different places that we tap in EFT are on the different energy channels, the different meridians, but specifically linked to core emotions or presentations. And it's standardized to capture the most powerful points so that no matter the presentation, it will probably cover what a person needs. So when you know more about the different meridian points, you can go more to the point that's associated with that. So like I said, if shame is a key element of what we're discussing, then we might not focus on all of the other places. Or tapping through, someone might notice, tap in one point, oh, a lot moved then. And they might notice that through yawning. We often yawn as energy moves. Some people burp, or having a sense of the energy moving in their body or tingling. Or they just might feel something changing. So might then stay at that point for longer until they feel, that's something's moved through there. That's enough there. There's a lot in my work about how we've been disconnected from our innate inner knowing and our wisdom, and how this work helps us reconnect and listen deeply.
Is there, to your knowledge, an evidence base around this? I'm thinking of barriers to why people wouldn't explore this, or why people might be skeptical. Adopting creative approaches and alternative approaches to the traditional medical model are far more effective. And I think people are really crying out for that as well. So is this approach, is it able to be researched? Do they do clinical trials on it, or what do you know about that?
Yeah, absolutely. There is a growing evidence base, and all of the most recent research is captured by, there's an international body, the Association for Comprehensive Energy Psychology, ACEP, ACEP. And on their website, they have a dedicated area to all of the research, and they're also invested in developing and gathering more research. So their practitioners, there's teams where they record the data of their sessions and are contributing to research projects as well.
With people not necessarily needing to do the training, but being able to incorporate some energy psychology, what would you suggest would be the first port of call? If someone is interested in where to begin, where's a good starting point, would you say?
I've got a little introductory video to EFT on my YouTube channel, but there are so many introductions to EFT, and I think that is a lovely place to start. And I would suggest using it on self before sharing it with others, as I suggest with and believe that we should do with all of the practices we bring into the clinical room. But also, I think this work is really powerful for therapists. And there's something in this work that we refer to as energetic boundaries. So when my energetic system meets the energetic system of another, if I have strong energetic boundaries, then I won't be taking on the energy of the other. I can meet them and I can have a nice relationship, or I can do good work, but I'm not absorbing their energy or taking that on. But often we come into caring professions because we care, and we have a history of being drawn into caring for others, and our energetic boundaries are not always 100%. So there's a number of things we can do. We can use the energy work to clear blocks to having healthy energetic boundaries. This is particularly useful for family members, partners, when we're noticing we're being drawn into things. But it's a really lovely practice before and after therapy sessions to visualize and breathe into and strengthen our energetic boundaries. That we are less, let's say, porous or less likely to absorb the energy of the other.
Yeah. Are there certain clients that, in your experience, haven't responded particularly well to energy psychology? If there's like complex trauma, is there a situation in which you might say use EMDR over what you might usually use because of what somebody's shared?
Yeah, the only thing is if someone doesn't believe in energy or doesn't feel comfortable working in that way. I do have a couple of longer term clients who came requesting EMDR, and that was absolutely their preference over the energy work, and that's fine. But for complex trauma, the energy work, and like I say, combined with the IFS, I think is gentle and powerful. That's the words I use.
Yeah.
Because you're absolutely meeting someone where they're at, what they're able to manage. There's something else in the energy psychology work called reversals. I was talking about our natural state of being is in flow. Some of the experiences we have, we've said, can block, but also can reverse our natural flow of energy. And if we've got energetic reversals, then it can be really hard to make change. So they can be things like And I struggle not to combine everything with the parts work because that's the language I use. So I'm not exclusively talking from an energy psychology, but whilst most of us, especially as therapists, might feel deserving of change, that change is possible, we might hold a part of us that at one point in our history has believed we're not deserving of change. It's not safe to change in this particular way. It's not possible. And that can show up as an energy reversal. So working with parts and energy to clear that reversal, return things to flow, then change can happen much more rapidly.
One of the final questions I have in thinking about what you are unblocking and therefore unlocking is if like in EMDR is the only thing I can liken it to, when you're processing, sometimes you can get really huge affect and it can be very destabilizing for somebody. So the prep work in EMDR is essential. Is there anything that you have to do before you start unblocking in energy psychology? What if someone dissociates whilst you're doing that? Does that ever happen? And how do you work with that from an energy perspective?
Yeah. Like I say, I find the energy work more gentle and yet
Okay.
better. So, of course, working with complex trauma, you don't dive into the trauma without doing the preparatory work, but it might look a bit different. And for example, there's a method in EFT called tearless trauma, where you can tap on the story and come to any point that is charged. But if you take that a step back, you can tap on even talking about the story. So you'd find the place that person is ready to work, and you, like I said, take the layers off. So coming to speak to me might bring a lot of embodied anxiety or fear. So we can work on, what's it like to be here? What are you noticing? The fears about talking about this thing. And like in EMDR, you don't have to name the presenting issue. The same with the energy work. So you can work without naming what's happened.
Coral, we are almost at time. This has been fascinating, and I'm really glad that I've got a first-hand experience what it is like to feel a shift from doing that. And also it's a reminder of how vulnerable it can be, I think, for our clients, and just to remember that. If someone wants to get in touch with you or would like to do your introductory video or course, how do they go about making contact with you?
So I've got a website, theenergypsychologist.org. That's the best place to find me.
Great.
Hopefully you'll share my social media and things. I put things on YouTube and Instagram. I do want to say I have a particular way about me, and some people like that and some people not so much. And for those who are thinking, oh, this is all rubbish, there are people within the energy psychology community that are much better at explaining the science and might communicate in a way that is more accessible than my way of explaining things. So don't take me as the spokesperson for it all. The research is all there and drawn out, and people are very encouraged to be skeptical, but don't stop at me and my voice.
Coral, I think you've done a fab job. This is complex, isn't it? It's rooted in Eastern traditions over centuries. It's not just something that's the new trend. And I think it's important to remember that historically, I think humans have been a lot better at embodying alternative approaches. In a way, our medicalized approach is the new thing. The medications that we take and the way that we treat disorders, that's what's new, not thinking about, plants and the breath and the ground and the earth. So it's been really interesting, and I hope the listeners have got as much out of it as I have. Thank you for your time, Coral.
Thanks, Natalie. So lovely to talk with you. Thank you.